PGTA stands for Preimplantation Genetic Testing for Aneuploidy. And aneuploidy is the copy number of chromosomes. So we know that age-related infertility is a huge problem, especially for women. So as women get older, we see irregularities in the number of chromosomes in the eggs. So when we create the embryos in the IVF lab and they develop, we can take a few cells from the developing embryo to test for this aneuploidy. And it's a problem because if the chromosome number is not correct, the transfer of such an embryo could result in no implantation or a miscarriage or even a baby with an affected condition. So taking a few cells allows us to test the health, the genetic health, so to speak, of the embryo, the number of chromosomes in the embryo, so that we can preferentially choose the ones that have the right number. So it's an amazing technique. We use micromanipulation in the embryology lab just to remove a few cells. We don't harm the embryo. It's an invasive methodology, but the embryo is very robust at this stage, and the testing is really valuable to help us choose the best one. PGTA is typically offered to women of advancing age, so approaching 40. We would certainly be talking about it, maybe over 35, and it depends on the previous history, but as women get over 35, their fertility declines quite rapidly, and this is because of aneuploidy, so incorrect copy number of chromosomes. So we will talk to patients in the consultation room about PGTA where it's indicated. It's not for everybody, but there may be cases that aren't related to age, such as previous miscarriages or poor egg quality. So different situations where we'll talk to patients, but we will certainly be recommending it to patients where we see the value for them.